Hey, good morning, everybody. Welcome to today's webinar, the final webinar of 2018 for the Tennessee SHIP SMP Volunteer Update Series webinars. We've had 9 this year, and we've had over 120 staff and volunteers for the program attend at least one of these webinars. So we appreciate your attendance and your willingness to get updated information as often as we can bring it to you. Today in particular, we are going to be talking about the 2019 Medicare updates that we have. So we'll be going through about 14 slides, which doesn't seem like that many, but I think some of the slides are going to spark some questions from the audience. In terms of questions, if you have a question, please feel free to chat them into the chat box at any time, and I'll stop the presentation and address the question. Or feel free to unmute yourself and ask the questions verbally if you prefer that. So, of course, we've been talking about this for a couple of years now, but I wanted to remind everybody that the new Medicare cards are coming. I believe Lonnie sent us an email yesterday that Tennessee may be getting new Medicare cards as early as October. It's not confirmed, but we are in wave 7. Oh, it's true. Okay. So
that is correct. I have actually changed the wave timeline to wave 7 will be mailed out in October.
Okay, and Tennessee is in wave 7, so you should be hearing a lot from your beneficiaries, whether they're your clients, people that come to your senior center, residents, whoever you talk to that has Medicare. They will be getting new cards coming in October, so be prepared to see a lot of Medicare cards that look like the Medicare card on the screen. So to go over real quick some of the changes that have come with the new Medicare card, there is no Social Security number any longer on your Medicare card. It's going to be an 11-digit code almost, a mixture of letter and numbers, called the Medicare Beneficiary Identifier. But it's still on the card. We still refer to it as the Medicare, the Medicare number. So you can see it's a mixture, but it has no identifying information. So this cannot be linked necessarily to someone's bank account like your Social Security number can. So this is going to be cutting down, of course, on identity theft and things like that. This is a good thing. And we still have our Medicare start dates for Hospital Part A and Medical Part B. Those are very important dates as we're comparing plans and things like that. You'll also notice it's still the red, white, and blue Medicare card. It's formatted a little different. The design has changed, but we're still red, white, and blue. The 1-800 Medicare number has been taken off, as well as the gender has been taken off. And lastly, the signature line has been taken off. So, still the information that we need to do comparisons and things are still on there. One really cool thing about the new Medicare card is that if for some reason a beneficiary's Medicare card has been stolen and used for fraudulent charges, they can get a new Medicare number. Before these new Medicare cards, you weren't able to get a new Medicare number because it was your Social Security number. They can't issue you a new Social Security number. So this is going to help a lot of people whose numbers have been compromised be able to get new numbers and not have as many fraudulent charges. As we know, with the good also comes the bad. So we are getting a lot of scams and a lot of misinformation about the new Medicare cards. For example, we all know Medicare will never call a beneficiary. So we do have some scammers calling saying that this is Medicare. We need to confirm your Medicare claim number so we can send you your new card. Things along that line, which is not true. You do not need to confirm your Medicare number. Almost 60 million Medicare beneficiaries are going to get this new card, and with that comes about 1.3 million here in Tennessee. So before I move on, do we have any questions about the new Medicare card? One clarification, notice how when I said you only get a new Medicare number if your card was used for fraudulent charges. If you just lose your Medicare card, you'll get a new Medicare card with the same Medicare number, unless it can be proved that your card was used for a fraudulent charge, then you can get a new number. But if it was just lost, then you're just going to get a new card with the same number on it. Okay, I don't see any questions, but again, as we go along, if something pops up, please feel free to ask. So we do have some new Part C and Part D numbers, and when I say Part C, of course, I'm referring to a Medicare Advantage plan in terms of the drug coverage. So we do have an increase in our Medicare Part D as in drug deductible, and that is going up to a maximum of $415 in 2019, which is a $10 increase from this year. That doesn't mean that every drug plan is going to have a $415 deductible, however. We know there are some drug plans that have a $0 deductible, some have $150, whatever they want, but it can be no more than that $415. We also have a new donut hole. Some new information on that. Or the coverage gap is what it's also known as. It's more commonly referred to as the donut hole, but it's also known as the coverage gap. So I've had many people tell me that I need to figure out a different way to explain the donut hole, and I apologize. I have not had time to figure out a new way and learn a different way to explain the donut hole, so I'm still using my Medicare Bob. So bear with me, and I apologize. I haven't had time to learn a different way. But when you think of the donut hole, I want you to think of the full cost of your medications, what you pay, what the insurance company pays, the full retail cost of your medication. When that number in 2019, so anything I say in 2019 starts January 1st, 2019. Not today, it starts in January. So when the full cost of your medications reaches $3,820, you fall into the coverage gap or the donut hole. In 2019, you will pay 25% of the cost of your brand name medications, and you will pay 37% of the cost for your generic medications. A couple months back when we did a webinar in July, I had the question of, you know, I heard that the donut hole is closing in 2019 rather than 2020. That is false. So the brand name percentage has decreased. It was supposed to be initially 30% for brand names in 2019, but it has closed for the brand name drugs down to the 25%. However, we still have a higher percentage of 37% for generics, so the donut hole is still open. And that is confirmed by the National Council on Aging as well as Centers for Medicare and Medicaid Services from a conference that the staff went to in Atlanta. So yes, we're getting smaller in closing, our smaller percentages, but it is still open. Now, when to get out of the donut hole, your $3,820 has to increase to $7,653.75. Again, that's the total cost of your medication. So we had a question come in, so are you saying there is no donut hole in 2020? So to clarify, the donut hole is when you have to pay a higher percentage than the initial coverage period for Medicare. And the initial coverage period is a 25% equivalent of the cost of your medications. So in 2020, your brand name medications will be no more than 25% and your generics will be no more than 25%. So it will be the same level as your initial coverage, meaning that the donut hole has essentially closed. However, does that mean that we won't see increases in costs? No. We don't know what that's going to bring in 2020, but we could still see some of these starting figures and ending figures, and then when someone hits those, you may pay the full 25%. We're not sure what that's going to look like in 2020. Okay, so going to my lovely Medicare Bob. I love him so much. He's missing his Newsies hat, though. I'm a little upset that we changed the diagram, but it's okay. It's okay. So here is Medicare Bob going through the roller coaster that is the prescription drug benefit for 2019. So first, he may be in a plan that has that $415 deductible. So anytime you have a deductible, you are paying 100% of that cost. Once he pays his deductible, he's in what we refer to as the initial coverage period, which is the equivalent of the cost of 25% of the medications that you take, roughly. Then, warning, warning, danger, danger, the full cost of his medications reaches that $3,820, and he falls down into the donut hole. Now, prior to the Affordable Care Act, and I always stress this when the Affordable Care Act comes up, when you put your SHIP hat on and you are a SHIP counselor, we call the Affordable Care Act by the name of the law. You can call it the Affordable Care Act, you can call it the ACA, you can call it the Patient Protection and Affordable Care Act, but we do not call it Obamacare. That is kind of the slang term. We refer to it as its name, the Affordable Care Act. So before the Affordable Care Act was fully implemented, the beneficiaries were responsible for 100% of the cost of their medications when they fell into the donut hole. Due to the Affordable Care Act law, that is why our donut hole is closing, and in 2019, the beneficiaries responsible for 25% of the cost of brand names and 37% of the cost of generics. Once the full cost increases from that $3,820 and increases to that $7,653.75, then the beneficiary is out of the donut hole and goes up into what we call catastrophic coverage, where they are then responsible for the equivalent of 5% of the cost of their medication. So we kind of have a little roller coaster going. So does anyone have any questions about the coverage gap or the donut hole? And of course, I have to give credit for my Medicare Bob to the National Council on Aging for putting this diagram together. Okay, I don't see any questions coming in, but please feel free to ask as we go, like I said. So here is how the coverage gap is improving. So here's what we had in 2018, which is still active until December 31st. So if someone fell into the coverage gap or the donut hole this year, they would be responsible for 35% of the brand name medications and 44% of the generics. And we can see that that is closing. So in previous documents, especially when we go through initial training, and a couple of people on the webinar today went through initial training Tuesday and Wednesday of this week, in our books it says that this is supposed to be, 2019 is supposed to be 30% of the cost of brand names. It has been updated, and we can cross out that 30%, and it is 25% next year. And then we can see the 25% and the 25% for 2020. The question came in, will the donut hole ever go away? My guess is no. So there will always be, technically the donut hole will close in 2020. So we're not having higher coinsurance than what the initial coverage level offers, but we may see the full 25% be applied to beneficiaries. And technically that can happen right now. So drug plans can say, you're paying the full 25% cost of all your medications all year long. Many of them don't do that. Many of them have co-pays for a tier level that the medication falls on, but that 25% is the standard coverage for a Medicare drug plan. Oops, do I have a question? I thought I heard something. So we've talked in the past, and you guys have heard during initial training, about the income-related monthly adjustment amount, or IRMA for short. So IRMA is when Social Security looks 2 years back on your tax return to determine what your premiums for that year is going to be. So we don't have any information on Medicare Parts A and Part B yet. So your hospital and medical insurance, they have not updated what those premiums, deductibles, and copays are going to be in 2019 yet. We usually get that information around the middle or end of November. So once we get that information, we will be sure to pass it along to you. But we do have the IRMA amounts for Part D prescription drug coverage premiums. So we're looking at 2019, like I said. So that means Social Security is going to look back at your 2017 tax return, And if you're a single individual and made $85,000 or less, or a married couple and made $170,000 or less, you just pay that plan's premium, whatever that's going to be. For example, this year the lowest premium in Tennessee is $17.70. We don't know what the lowest premium next year is going to be. We'll get that information updated in the Medicare.gov plan finder starting October 1st. So about 10 days away or so, we'll have some more information on that. But if you make above those two numbers, you can see your premium is going to increase. And some of you may have never counseled a beneficiary that's had an income over the $85,000 or $170,000. But for those of you who have, we actually have increased to 6 tier levels of income, where we used to only have 5 tier levels of income. So you can see your premium is going to increase by either $12.40 all the way up to $77.40, depending on what your income was in 2017. And when I say income, I mean the modified adjusted gross income that's on your tax return, the MAGI, in other words. The question came in, is that the exact money you got in your pension or salary, or is that the number adjusted by other deductions first? It's the modified adjusted gross income, so I'm not sure if that does include or doesn't include deductions, because I'm not a tax person, so I apologize. But it is the modified adjusted gross income. So we have a lot of beneficiaries who in 2019, maybe they stopped working or they retired, but in 2017, 2 years ago, they were fully employed and they were making quite a bit of money. So if a beneficiary, let's say I was the highest sales rep in my company and I made $600,000 in 2017, but in 2019 I retired and now I'm only making $100,000. So even with that, I would be paying $77.40 on top of my drug plan premium. I can appeal that through Social Security, and you all know that when a beneficiary is not happy with something, we always encourage them to appeal things. And if you aren't comfortable with appeals, you just refer that on up to your regional staff, and we will work on the appeals for the beneficiary and with you so you can kind of see the process. If you're interested in the process, I understand if you don't want to do appeals. So they just fill out a form from Social Security and they kind of detail their life-changing circumstance that made their income decrease. And Social Security could reevaluate that and maybe decrease the amount of premiums you pay. If not, then eventually it's going to even itself out. So in 2020, they're going to look at your 2018 tax return. In 2021, they're going to look at your 2019 tax return, see your drop in income, and adjust your premiums accordingly. So there's 2 ways to get out of possibly having to pay that higher additional premium. And like I said, we don't have information on Part A and B yet. I have a feeling if the Part D is in drug IRMA is changing, I'm fairly confident that the Part B IRMA is changing. And actually, these numbers have decreased. So last year, if you made over the $85,000 mark, your premium was increased by actually $13. So we have decreased a little bit. I mean, little is better than nothing. So those premium amounts have decreased from 2018. Okay. So we have some new extra help copays. So when I say extra help, I am referring to the Low Income Subsidy Program, or LIS, or we more commonly refer to it as extra help. All 3 of those are the same thing. And extra help is when you apply for assistance to help pay for the Part D medication costs through the socialsecurity.gov website. So the generic copay is increasing by 5 cents, and it's going to increase to a maximum of $3.40. Your brand names are going to increase by 15 cents, and your maximum is going to be $8.50 in 2019. So in initial training, we talk about some letters that Social Security mails to beneficiaries who have a change in copay, and it's an orange letter. and it gets mailed out in October, so it's very fitting for Halloween. So I just want to make everyone aware that as you're counseling a beneficiary and they say, I received an orange letter from Social Security, what does this mean? That orange letter is notifying them of their $3.40 and $8.50 copays for their generics and brand name medications because they qualify for that assistance. Just a little heads up for that. We also have a decrease, so a lot of decreases, some increases, of the Part D beneficiary, Part D base beneficiary premium, or sometimes what's referred to as the Part D benchmark. In 2018, it was $35.02. It is going down to $33.19. So what does this number mean? Why is this number important? It's important for two reasons. The first reason is when someone qualifies for extra help or low-income subsidy, they're given a monthly amount to go toward their Part D prescription drug premium. That number this year, they're going to get $33.19 a month in sort of kind of a stipend to go toward that Part D premium. So, for example, if I had a $17.70 a month premium and I have a $33.19 allowance toward that premium, my premium is going to be free, provided that my drug plan participates with extra help. But in this scenario, let's say it does. Now, on the reverse side, if I have a premium of $40 a month and I only get $33.19 stipend, I'm going to pay the difference. So I'm going to have, what is that, a $6.81 a month premium instead of that $40. So I do get that decrease. The second reason why this $33.19 is important is because it's also based on if anyone has a Part D as in drug penalty, which is 1% for every month you were eligible but did not enroll. Your premium amount is, or your premium penalty is based off of this $33.19. So if I had a 20% prescription drug plan penalty because I was without coverage for medications for 20 months, it would be 20% of this $33.19. So I always get the question, why isn't it just 20% of my plan's premium? Well, because that's really not fair. So if I'm enrolled in a $17.70 a month premium and Lonnie, for example, is enrolled in a $70 a month drug plan premium and we both have a 20% penalty, I'm paying way less than she is for having the same penalty. So they do what's called the benchmark or the Part D base beneficiary premium, so everyone is paying toward the same kind of penalty based on their percentage.
Can I ask a question before we go on?
Yeah.
I assume that I've been working with beneficiaries that are currently on extra help. When you look at the Aetna Medicare Select, the $17.70 premium, when I go back, if I go back out, if we're not sure they're going to go get it and look at it, will show that they will still owe $1.30. Well, $17.70 is a lot lower than the average premium. So how is that? Is Aetna not fully in the extra help program, or where would that come from?
It is possible, and I don't know this for sure because I haven't looked into it, but if there is a plan's premium that is lower than the benchmark or the base beneficiary premium and you still have a premium with that plan, they are not fully enrolled in the extra help program. So most likely that's why they still have some premium.
Yeah, okay. That's what I was figuring. So that's why I wanted to know. Okay, thank you.
Yeah, just look at, if you've got a Medicare New Handbook, it's only the plans that are marked in blue that are participating.
Yes, so Lonnie's referring currently to the 2018 Medicare New Handbook. We will be getting 2019 versions soon, fingers crossed. I'm hoping we will have the 2019 versions here on time for our statewide volunteer conference in Murfreesboro on October 4th. Fingers crossed, if we have them, we will be able to give them to those of you who are going to be in attendance. But Lonnie is absolutely correct that if you have the Tennessee-specific Medicare and You Handbook, which means on the very back cover you have the Tennessee SHIP toll-free number on the back, and then starting around page 132-ish, we'll have all the plans specific to Tennessee, and any premium that's highlighted in blue, like she mentioned, will be a $0 premium plan for those beneficiaries who qualify for extra help for low-income subsidy. We did get a comment from one of our volunteers that they got their Medicare and You Handbook in the mail yesterday, so that is great. We ordered about 750, so it may take them a little longer to get to us, but I'm glad that people are getting them before October. That's great. We also had a question or scenario. So if you are 12 months penalty, it is 1% per month, not had drug plan, and then this time $33.19. Am I right? Okay, so yes, I think if I am reading that correctly, if you went without drug coverage, credible drug coverage, you had no credible drug coverage and you did not have a Medicare prescription drug plan for 12 months, that's 1% for every month you were eligible but did not enroll, so that's 12%. And starting in 2019, so not starting right now, but starting January 1st, 2019, that 12% penalty will be applied to the $33.19. And whatever that total is in the math will be added to your drug plan premium. So again, not right now. So in 2018, we're still looking at $35.02, but starting January 1st, 2019, it's going down. So penalties will decrease next year for those people who've accrued penalties using that $33.19. Great question. I do like to remind everybody that when it comes to extra help through the low-income subsidy or even the Medicare savings programs, QMB, SLMB, and QI1, the 2019 federal poverty levels usually don't get released until late February, early March roundabouts, maybe early February. It kind of fluctuates every year. So we do ask that you continue to use the 2018 income and resource guidelines probably for a good majority of the first quarter of next year. But as soon as we get those new levels, we'll be sure to get the information out to you. And I'm sure next year for the volunteer webinar series that will, usually we have that presentation scheduled for the March update training to make sure everyone gets that update. So be looking for that early next year, but continue to use the 2018 guidelines for the rest of this year and a little bit into 2019. Okay, did I have other questions? I'm hearing a little bit of static. I don't want to miss anybody's question. All right, moving right on. So we have some new information on the annual notice of change, or the ANOC, and the evidence of coverage. So for those of you who don't remember what these two are, evidence of coverage is kind of your drug plan summary of what you and your drug plan have paid towards your medications. So that's your evidence of coverage. And then the annual notice of change has to be sent from your drug plan to the beneficiary before, well, we'll get to that in a second. But basically it explains all of the changes to your current drug plan. It'll say if your premium is going to increase or decrease, deductibles, formulary changes, tier level changes, all that good stuff that the plan is going to change for 2019. So previously, before 2019, again, everything is starting January 1st, 2019. Previously, oh, actually, that's what's on the presentation is wrong. So usually these two things were mailed together in the past. So do me a favor, and I apologize, I'll update my slides when I send them out. But this separately should really say together, because separately is up here. So this year, starting in 2019, the annual notice of change and the evidence of coverage can be mailed separately. Previously, like this year, the annual notice of change and the evidence of coverage have usually been mailed together. So I like this. I think this is wonderful because I've got a lot of clients after open enrollment, or excuse me, after the annual enrollment period. I'll tell you why I changed what I said here in a little bit. After the annual enrollment period, October 15th through December 7th, usually around January and February, we always get calls that I didn't know that my drug plan's premium was increasing. I didn't know my drug plan wasn't going to cover my medication anymore, or I was never notified. And normally, when the annual notice of change and the evidence of coverage being mailed together, we have some beneficiaries who never opened their evidence of coverage letter. So therefore, they never saw their annual notice of change. Now that they're being mailed separately, beneficiaries may realize that changes are coming and look for that annual notice of change because it's going to be mailed separately. So the annual notice of change is due to all Medicare beneficiaries by October 1st. So that's not changing. That is the same. The evidence of coverage used to be due October 1st as well because you could mail them together. Now drug plans have until October 15th to be able to mail out that evidence of coverage since they can be mailed separately. But you also the annual or the evidence of coverage cannot be distributed electronically. That has to be in a paper form. But they can post some things on their website, but the beneficiaries have to be notified a hard copy that their annual notice of change is going to be posted on a website. Maybe there's a portal or some electronic way, a secure way. So when I say they can't be distributed electronically, it can't be emailed, kind of an unsafe, unsecure way of distributing. But they may have a portal on their website, but they have to be notified hard copy. Here's a step-by-step way of how you get your evidence of coverage online now. So two very important documents that all of our beneficiaries need to pay attention to. So any questions on anything before we get into our Medigap changes?
Are they required to hard copy mail the evidence of coverage? Because a lot of the people I talk to, they're not computer literate. They don't have access to computers.
Well, they're required. Oh, sorry. They are required to notify the beneficiary's hard copy if it's going to be posted electronically. If it's not posted electronically, then they will send a paper notice of evidence of coverage.
But if they're posting it electronically and someone doesn't have a computer, do they have to send them a hard copy notice?
I would, and I'm not sure 100%, but I'm sure the beneficiary just has to call their drug plan and request a paper copy.
They mail it. Okay.
Yeah, and tell them to mail it, and they'll be able to mail a hard copy. Oh, we have questions. Oh, you're welcome. Had a client report that he or she received the 2019 Medicare New Handbook. Yay. After reading it, she understood that SLMB would no longer cover Part B premiums. Have we heard anything about this? No, that is brand new information to me. If you could ask the client to scan you a copy of that page, that would be very helpful. But no, we have not been told that the benefits of any of the Medicare savings programs are going to change. That is definitely new information, and if you can send that to me, we'll get it confirmed. We had another comment that a lot of people in a membership does not have, so a volunteer knows a large group of people who does not have computer access. Again, all the beneficiary will most likely have to do is contact the drug plan and say, I don't have access to a computer, you need to mail it to me hard copy. They have hard copy available, and as long as it's on record, they should be able to do it. All right. Great question. So our 2020 Medigap changes. So when I say Medigap, I am referring to the Medicare supplemental insurance plan. You can only get a Medigap policy if you are enrolled into Original Medicare, meaning you use that red, white, and blue Medicare card when you go to the doctor or the hospital. And what I mean by changes is we all know that effective January 1st, 2020, so we're still a little over a year away, but man, it's been creeping up on us quick. January 1st, 2020, Supplemental Plan C and Supplemental Plan F as in Frank will no longer be sold. Now, I really want to harp the phrase, no longer sold. We're getting a lot of reports from a lot of different beneficiaries that staff and volunteers are telling them that Plan C and Plan F are going away. That is not true. That is false. They are still going to be around, but they're no longer going to be sold. Those are two completely different things. I had a question come in, should this not say 2019? So the Medigap changes are not in 2019. The Medigap changes are in 2020. So this is a year and a half, year and 3 months away. This is not coming 2019. This is coming 2020. Again, so do not say that they're no longer being sold because they are being sold. Or sorry, they're no longer being sold is correct. Please don't tell beneficiaries that they're going away because they are still going to be around. So I say this because on or after January 1st, 2020, the reason why Plan C and Plan F are no longer going to be sold is because they provide coverage for that Medicare Part B as in boy deductible. So if I go back real quick, you'll notice the one special thing about Plan C and Plan F is they both cover that Part B deductible right here. That's why I'm saying that. And the Part B deductible in 2018 is $183. We don't know what 2019 is yet. So because those two plans cover Medicare Part B deductible, they will no longer be sold as of January 1st, 2020. So Plan C and Plan F will remain available to those beneficiaries who already have them, meaning if you currently today have enrolled in a Plan C or Plan F, you can continue that coverage. If you want to enroll in a Plan C or Plan F in December of 2019, you can do that. However, when a beneficiary has Medicare Parts A and B in January 2020, they will not be able to purchase a Plan C or Plan F. They are guaranteed renewable, meaning as long as you pay the premium, you will continue to get that C and F benefit. The only way that your Plan C or Plan F will go away is if you either stop paying that premium or you enroll yourself into a different plan. So again, Plan C and Plan F will still be around. Here is the biggest update that we've got. There will be no federal guaranteed issue rights. So there will be no time frame for a beneficiary to change from Plan C or Plan F with no medical underwriting. So meaning January 1st, 2020, someone wants to change their Plan C or Plan F, and they are outside of any guaranteed issue rights, they will be subject to medical underwriting and could be denied for pre-existing conditions. We had talked in the past that was one thing that we were waiting on. To see if we would get some time frames for those beneficiaries who have a Plan C or Plan F to switch to a different plan, and they are not going to get that federal guaranteed issue right. And there are ways for beneficiaries to still be able to change. So we do have the beneficiaries who may want to change because they feel maybe their premiums will increase or something along those lines. It is much easier to change to a different Medicare supplemental plan within your parent company that you're enrolled in. So, for example, if I have a Plan F with Blue Cross Blue Shield, it's going to be easier for me to go to a Plan G or A or whatever lower level coverage plan within Blue Cross Blue Shield than it is changing to a completely new insurance company. So there is going to be a way, they just have to talk to their insurance company if, and some people may not want to change. But if someone wants to change, they need to talk to their insurance company and see if they can get into a different coverage level plan, if they want to.
So the Medigap insurers are not required to put it through underwriting, but they may elect to put it through underwriting.
Correct. It's all up to the individual,
insurance company.
Yep, absolutely.
Okay.
I called a different company, and they told me no matter what, even within their own plans, they would still put the person through medical underwriting.
Exactly. It's going to be plan-by-plan basis. There's going to be no way for us to be able to tell a beneficiary, yes, your insurance company will let you decrease your coverage with no medical underwriting. Do not say that. We cannot guarantee that. All we can say is it may be possible. What I would recommend is you talk to your supplemental insurance company plan and see if you can change, but we cannot guarantee someone's not going to be subject to medical underwriting. And, of course, we never want anyone to change, we never want anyone to drop their Medicare supplemental plan before they know that they're going to be enrolled into another one, because then they're going to lose their coverage altogether. We had a comment come in about a beneficiary who has a pre-existing condition, and they will not reassure you have had this several times. I think it was they will not. I don't know if reassure you is the best term, but they'll probably they may subject you. They're definitely going to subject you to medical underwriting. So that could mean a wide range of things. One good tool that we have, that all of us have here at SHIP staff and volunteers, is the Medicare.gov, or excuse me, not Medicare.gov. We have the Medigap comparison tool for SHIP staff and volunteers. I don't have it on this presentation, and many of you already have a portal, but we do have an online tool where you can go on and compare Medicare supplemental plans. And there is a section of that tool where you can put in certain pre-existing conditions and see what that look-back period is. So that's a tool that you have at your resource. All righty. Questions on that before we get into some new vocabulary that we need to learn that I am even struggling with? So it's going to be fun to try and learn some new words. Okay. First thing we need to do is change our vocabulary. And instead of calling October 15th through December 7th open enrollment, we really need, and it may not be that other agencies, federal, state, local, are changing their vocabulary, but I really feel it's important for SHIP staff and volunteers to change our vocabulary. So October 15th through December 7th, we should refer to that as the annual enrollment period, or AEP. This is usually what we refer to as open enrollment. I slip up all the time, but try to, from here on out, call that the annual enrollment period. Why do I need to start calling this something different? Because starting January 1st, 2019, we are going to start to have the Medicare Advantage Plan open enrollment period. So using open enrollment twice is going to confuse our beneficiaries because they are two different times of the year and two very different things can happen during this time. I do want to tell you October 15th through December 7th has not changed. This is still when beneficiaries can change their drug plans or Medicare Advantage plans. This is still the time that is kind of a free-for-all for everyone to compare their plans and try and save themselves some money for 2019. October 15th through December 7th, annual enrollment period, staying the same, nothing is changing. Okay? What is changing is this new time period for the Medicare Advantage Plan open enrollment period between January 1st and March 31st, so the first quarter of the year. So what is it? During this time period, first and foremost, the beneficiary must be enrolled into a Medicare Advantage plan starting January 1st, 2019 for this time period to apply to them. If you were on original Medicare, this part of the year, this 3-month period does not apply to you. Now, we had some information on this a couple months ago, and I apologize that I was given some misinformation, so I am updating this. So this is the correct information. I had a question come in about a Medigap, so let me address that real quick before we get into this. So lacking initial enrollment or special enrollment, there are really not open enrollment for Medigap plans. So when it comes, and I'm sorry, I'm backtracking a little bit. So when it comes to a Medicare supplemental plan or a Medigap policy, there is no time of the year that you can change that is set in stone. There's no, open enrollment for that or annual enrollment period for that. The only time that you can switch a Medicare supplemental plan and not be subject to medical underwriting is if you qualify for a guaranteed issue right. Most beneficiaries will get one, and that is from the first 6 months that they have Medicare Part B as in boy. They will not get subject to medical underwriting after that. There are 7 other guaranteed issue rights that I'm not going to get into on this webinar. There's actually a webinar on our YouTube channel, I believe from last year, that we go over the Medicare supplemental plans and the tool that I mentioned a little while ago. So I would encourage you all, if you're more interested in the guaranteed issue rights for a Medigap policy, that you go back and look at that webinar on the YouTube channel.
Sydney.
Yes.
Sydney, can you hear me?
Barely. You got to come to the phone a little bit more.
Okay. This is Walola. I'm trying to find. Okay, now you said that the Advantage program must be enrolled on January 1st. So I thought it was, maybe I misunderstood, January 1st through March 15th for the enrollment period. So are you saying, I need you to clarify that a little bit more.
Right, yeah, absolutely. So in order to use the January to March 31st time period, you must be enrolled into a Medicare Advantage plan on January 1st, 2019. So you have to be enrolled into a Medicare Advantage plan to use the Medicare Advantage plan open enrollment period.
It's a new.
So let's say, go ahead, I'm sorry.
New or anyone?
Any Medicare beneficiary, any Medicare beneficiary. So, for example, if I'm on original Medicare with a drug plan, I cannot use this January 1st to March 31st date.
Okay.
It does not apply to me. But if I have a Medicare Advantage plan on that date, I can use this. And it might make more sense here once I get into some examples.
Okay. Okay then. All right. Thank you.
And if not, please continue to ask me for clarification.
Okay. Thanks.
You're welcome. So, as long as the beneficiary is enrolled into a Medicare Advantage plan, and that's what MA stands for. I apologize. I'm going to get to a key on what my little lingos mean so I could save some space on slides. But MA stands for Medicare Advantage plan, or Medicare Advantage. A beneficiary is allowed to change one time during the January 1st to March 31st time period. Oh, here's my key. During January 1st to March 31st, one time during this time period, so one time during this year is what they say, that's CMS language, they can switch from a Medicare Advantage plan with prescription drug coverage. So MA is Medicare Advantage plan. If you look down here at my little red key, PD means Part D, OM means original Medicare. So you can change from a Medicare Advantage plan with prescription drug coverage to another Medicare Advantage plan with prescription drug coverage. You can change from a Medicare Advantage plan with prescription drug coverage to just a regular only Medicare Advantage plan with no drug coverage. You can change from a Medicare Advantage plan with no drug coverage to a Medicare Advantage plan with no drug coverage. You can change from a Medicare Advantage plan with no drug coverage to a Medicare Advantage plan with drug coverage. Or you can change from a Medicare Advantage plan to original Medicare. Now, Medicare prescription drugs, a Part D plan is not guaranteed unless you have prescription drug coverage with your Medicare Advantage plan. So what that means is if you're in a Medicare Advantage plan only and you want to go to Original Medicare, you're not going to be able to pick up drug coverage. But if you're on a Medicare Advantage plan with drug coverage, you'll be able to go to Original Medicare with a drug plan. You cannot, a beneficiary cannot switch from Original Medicare drug plans. So if you're on Original Medicare, you cannot change your drug plan during this time. And you cannot join a Medicare Advantage plan if you're on Original Medicare. So again, you have to have a Medicare Advantage plan on January 1st in order to use the Medicare Advantage open enrollment period from January 1st to March 31st. Who has questions? If nobody has questions, I explained that very well. So this is actually replacing the Medicare Advantage disenrollment period that we used to have from January 1st to February 14th. That will no longer exist. That's going away, and it's going to become the Medicare Advantage open enrollment period, again, January 1st to March 31st. If I haven't said that enough, those are very important dates, and I hope you wrote them down, but they are also on the previous slide. So, important dates. Also, backtracking just a hair, Lonnie did everybody a favor, and in the chat box, she put the link to the Medicare Supplemental Comparison Tool in there for you. And I will write myself a note to also include that in the follow-up email. That way everyone who doesn't have an account can set up an account if they would like one. All right, if there's no questions, we'll move right along. I believe this is the last slide of content. Like I said, there's not too many slides, but I thought we might have a little bit of discussion. So we do have, again, starting January 1st, 2019, we have new special enrollment periods for those beneficiaries who qualify for assistance, whether that be from dual eligibles, meaning they have Medicare and Medicaid, or for those people who qualify for low-income subsidy or a Medicare savings program. Anyone who has assistance paying for their drug benefits, they have a new special enrollment period. Starting January 1st, 2019, it is no longer continuous. A beneficiary will not be able to change their drug plan every month. January 1st, 2019, a beneficiary may only change their drug plan once every quarter for the first 3 quarters of the year. So what that looks like is a beneficiary with assistance. I really want to specify that. If the beneficiary does not have any assistance to pay for their prescriptions, this does not apply to them. This only applies to beneficiaries who have assistance help paying for their prescription medications. So the beneficiary can change one time between January 1st and March 31st, very popular time frame, one time between April 1st to June 30th, and one time between July 1st and September 30th. One time. Whenever they change, it's going to begin the first day of the next calendar month. So if I am a beneficiary and I change my plan in February because I have extra help, my plan will begin March 1st. The last quarter, notice how October 1st through December 31st is not listed. The last quarter is going to be just like open enrollment. So if you enroll between October and December, your plan will begin January 1st. It's not going to begin earlier. It's going to be just like the annual enrollment period. I probably just said the wrong term and phrase like I've been preaching for you guys to do and I can't do. There is a little bit more in-depth information that we found out in addition to what we talked about in July. So there are going to be some individuals who are notified that they are potentially at risk or at risk by their drug plan program who qualify for assistance. And what that means, is So these are the three things that the potentially at-risk or at-risk beneficiary, kind of the criteria. The decision is based on opioid use. Can everybody hear me? Because I'm getting little notifications that things are going away. So I just want to make sure people can hear me still. Okay, I got a message. Thank you. So who is potentially at risk or at risk? They look at opioid use, the dosages, and the number of providers that beneficiaries use. So if the plan determines someone is at risk or potentially at risk, they will not be able to use this special enrollment period. Now, the tricky part for us is we are not going to know who is at risk or potentially at risk. That's not going to show up on the Medicare.gov plan finder. Only the drug plan is going to know that. So we're going to do business as usual, and if someone has that extra help and they want to change their plan, we're going to do the what we normally do and try and help them out with that. And then if the drug plan notifies them that they're at risk, that's how they unfortunately find out. We are not going to know that in advance. Questions on that?
Will the beneficiaries be sent a written notice if the drug plan has identified that they're at risk so they will know?
Yes, they should be notified in written form that they are an at-risk beneficiary.
Okay.
Will they understand what that means? I'm not sure because I don't know what kind of language they're going to use, but they should be notified, yes, in the mail if the drug plan has identified them as at-risk or potentially at-risk.
So potentially, if we're trying to help someone and we do put their medicines on Medicare.gov and see those narcotics and opioids, we can say, have you received a letter from your drug plan about being at risk, to help us identify whether or not that situation is going to apply to them, or no? Do we not ask them?
I would, personally, I wouldn't, because that could cause some heated conversation between you and the beneficiary. Like, what are you trying to say? You think I'm a drug addict or something along those lines? So I would recommend staying away from that conversation.
Okay.
There was a question that if a beneficiary is at risk, can the drug company terminate them? No. A drug company cannot cancel anyone's drug plan benefits unless they stop paying their premium. For this in particular, what the drug plan can do is say, no, we're not going to allow you to change your drug plan even though you have assistance that you can, because you're at risk or potentially at risk. We want to keep you on our drug plan because we want to keep you on your drug plan. I thought I had more things, but I didn't. All right, so that's the end of what I have for the presentation. I believe we will have, so many of you, like I said, will be attending the October 4th statewide volunteer conference here in Murfreesboro, not here, but in Murfreesboro, Tennessee. We will be doing some updates similar to this, but we will, I believe, have some more and maybe even more clarifying updates. So I still encourage all of you to come who have already registered. If you haven't registered, please feel free to do so. Unfortunately, the time frame to request hotel accommodations has passed, so we're not going to be able to pay for your hotel. If you register and need one, you needed to do that by last week. But we are very excited for the conference because we have confirmed speakers from Social Security Administration, and we have confirmed speakers from the Bureau of TennCare. We're also going to be going over some complex scenarios and some other scenarios as well. We're doing kind of a beginner and advanced track. So for those volunteers who just joined the program, we do have a not-so-intensive sessions for you. And then for those who've been with the program for a while, we do have some more advanced complex topics to go over as well. So we are excited for many of you to be there. Does anyone have any questions about what we talked about on the webinar? And I understand that some people don't want to ask questions because of the recording. I will have opportunities to ask questions once the recording is done. I'm getting a little bit of feedback, so I'm going to mute some people. I apologize. Ooh. Oh, sorry, guys. We're getting a lot of feedback. Somebody's typing. Okay. They might be typing a question to me. I don't know. So with that, since we don't have any questions, I do want to remind everyone to please complete the survey for this webinar. It really helps us know what we're doing good, what we're doing bad, what you might want us to improve on. I do want to say, though, sometimes in the surveys we do get questions. Please don't put questions in the survey because the surveys are anonymous, and I don't know who to answer the question to. So if you do have a question about anything we've gone over today or anything we've gone over in the past, please feel free to email me directly so that way I know whose question I'm addressing. And we also, if you need any kind of reference back to this material, or I think Sydney said this, or she might have said that, we will be posting the webinar to our SHIP YouTube channel this afternoon. And there's a link down there if you need to go back to reference. And I got an email about the PowerPoint. I will, along with the link to the Medicare Supplemental Comparison Tool, I will send updated slides to everyone as well in the follow-up email for those who have registered. If you did not register and maybe you're listening in with someone or something along those lines, maybe you're in a big group, if you didn't register, you're not going to get the email because I'm only sending the email to people who registered for the webinar. So if you don't get an email, feel free to shoot me an email and I'll get you all the resources. We did have a question that for people who are not able to attend the conference in Murfreesboro, will they be able to get any of the critical updates that we weren't able to provide here on the webinar series? We will get all the information to your regional coordinators, and the regional coordinators will be able to send that information that they receive from the conference to you guys. Some of the coordinators may be having additional update trainings for those beneficiaries who are not able to attend. I don't know if all regions are doing that, but I do know a couple are doing that. So I would encourage each of you to contact your regional coordinators to see if there's any additional trainings coming up before open enrollment. We had another question, are the materials for the webinars on YouTube available to download? No. So the only thing that's on YouTube is the recording of the webinar, but anytime volunteers listen to the webinars on YouTube, please let your regional coordinators know so we can get that counted for your update hours. And then if needed, shoot me an email and I can send you all of the resources. We did have a recommendation by a volunteer to use Dropbox to do materials, and I have not had time, I'll be honest, to figure out how to use that. So that's something I will talk with my replacement about using for next year to increase the volunteer, or to improve the volunteer webinar series even more. So if you need any materials, shoot me an email. I have them all saved from 2018. I may be a little sketchy on the 2017 stuff, but definitely have all of the information from any 2018 webinar. I just had a question, are you leaving? So for those of you who may have joined a little bit later, and I thought I sent an email to everybody with this information, but I did accept a new position here at the Tennessee Commission on Aging and Disability. Actually, this slide is incorrect because it's not my correct title anymore. I have taken the position as the Director of Volunteer Services for the Commission. So, no, I will no longer be full-time with SHIP. I am going to be joining the ranks of you amazing volunteers. So until my replacement is hired, please feel free to continue to ask me questions. I'm still around. I get so many emails from staff and volunteers. We'll miss you. I'm still here, guys. I always tell people I'm like a cockroach. It's hard to get rid of me. I'm not going anywhere. I still have the same phone number. I still have the same email address. If you email me questions, I'll either answer them or I may say, hey, I'm going to refer this over to the new statewide volunteer program coordinator so he or she can answer your questions. But I'm still around. Please feel free to continue to email me, call me, all that good stuff. And to kind of close out the webinar before I stop the recording, I do want to thank each and every one of you from the bottom of my heart. It's been an amazing 8 years working with all of you. But I'm still around, so keep talking to me. But thank you all so much.